Dr. Aina. It's good to be here today. Good evening, everyone. It's my pleasure to be here. Thank you, Ma.
Welcome, Dr. Erex. Good evening.
Good evening, everybody. Sorry, I cannot share my screen yet. I'm trying to get into the house, just coming in from church. But I'm very happy. I'm very, very excited to be here this evening. Thank you, everyone. And we do hope that you have a very good time after today's meeting.
Okay, so we're just going to go ahead and start with the questions that we have. And as I said, if we have any questions, burning questions, we can drop them in the chat box. We will attempt to answer some of them as well. So the first question, it says, please, can a 4-week-old baby who has ankle dislocation from birth use a miracle balm? And I will direct that question to MI.
Hey. Um, yes, so of course, a 4-week-old baby is like a brand new baby. So there's a plus side of it, which says, which makes us realize that the baby system is still really like almost brand new and very, would I call it very malleable, very easy to adjust before it becomes tough for any change to happen. Okay, so for a 4-week-old baby as well, the skin is still very, very tender and very sensitive. So even though um, we recommend the balm, but because of the nature of a newborn skin, we would advise that it can be mixed with shea butter, so that the effect, the burning sensation will not be as much, and it can still be able to carry out the function that one wants it to carry out. It's still easier for a 4-week-old baby to have this location sorted in good time. So the balm works well, yeah. I would personally recommend it mixed with ori, which is the traditional shea butter, so that you can manage the burning sensation. Yeah.
Thank you very much, Emma. Yes, a baby has very tender skin, and the shea butter would give the baby a lower concentration of the ingredients and lower chances of effects. I don't know whether Dr. Rex has anything to add to that.
Oh, I think MI has actually said it all because orthopedically, that's for the bone doctors and even in physiotherapy, we use balms for newborn babies that have dislocation, that have club foots, that have to do physiotherapy because of one case or the other, children with cerebral palsy. So, like she rightly said, it's just to do a mix with the shea butter to bring down the tone of the intensity of the hot sensation, and the baby is good to go.
Okay, thank you very much. So we go on to the next question. It says someone with severe piles who started taking bitters 2 weeks ago just started bleeding yesterday. Please, what should he do? Maybe Dr. Rex would take that.
Okay, so for severe pain, who just started taking bitters about 2 weeks ago and started bleeding suddenly. I think the first thing is for us to check what is the cause of the bleeding. I would advise that the person does a scan. Let's be sure that there's nothing else that is responsible for the bleeding, because I don't want to believe that the bitters is responsible for the bleeding. Make sure the patient is not having a cancer of the colon, or the bleeding was not there before the bitters ensued. Maybe only saw it worse after taking the bitters. So I would advise person does the scan. But for someone with pile, like I've done in past time and still doing, I would recommend that the person use the cleanser alongside the balm. I mean the bitters, please. The cleanser alongside the bitters. So we don't just use only bitters for the pile. We use both the cleanser and the bitters. And I've found an immediate regimen to have that done so that we'll not have the frequency of the stooling. So we do the cleanser capsule in the daytime and the bitters, 10 mils of the bitters at night. We also need to find out what quantity of the bitters the person took, that the person stay having the bleeding, so that it won't just be a case of, because I actually had a patient sometime that came and saw the smallest bottle. And when I was talking to him about the price, he said, in fact, thank God they are still on a good baby. He just opened it and started drinking directly from the bottle. So we need to have balances in this. There's a dosage, there's a regimen per ailment so that we don't have drug overdose use. That's my suggestion. Thank you.
Thank you very much, Dr. Erex. Does Emma have any contribution to that?
Yeah, so I think Dr. Rex has done quite some justice to it, but I'll just like to add, understanding also sometimes that, okay, well, before I say that, I think I'll say that, if the person notices bleeding, it might not be bad to pause the use of the bitters for a day or two or three, take lots of water. And then when the person decides to resume, we may also want to take a look at, like Dr. X said, dosage. And then sometimes when there's bleeding, it's possible that there's some kind of ulcer. So apart from the dosage, you want to be sure that the person is diluting in water and taking a lot of water after use, so that we are sure that the possibility of ulcer causing the bleeding is taken care of. So I think that's what I would just like to add. It's not bad to pause for about 2 or 3 days, take a lot of water, observe, and then adjust the dosage to ensure that it's diluted before taking. And I also want to assume that this person is also doing a sitz bath. That would also help with
Yeah.
Yeah.
whatever may have been causing the bleeding. So I would say, for example, for the 2 3 days that the person is pausing the use of taking it orally, the person may want to explore sit bath for that period, just to be able to check. And I mean, I'm sure the seed bath will not do anybody any harm anyway. So just to put the bitters in water and sit so that the steam will go up there, and then help to sort out anything that may be going on down there all the way up. So I think that's the addition I just wanted to just put to it.
Thank you very much. Yeah, so after, making sure we rule out any sinister causes of the bleeding. The most sinister cause of such bleeding could be cancer. And once that is ruled out, yeah, the other measures, the sit baths, the taking the cleanser. Thank you very much, both of you. Okay, let's go to the next question. The next question says, my customer took Reader Restore and stooled for almost 2 days. What could be the matter? Would Emma like to start?
Okay, yeah. So I would like to share my own personal experience from the use of Restore. Yeah. So the first time I took Restore, I went to the toilet quite a bit. I went about 3 times or so, or almost 4 times in the first time I took it. And afterwards, my system adjusted. I just go to toilet normally now when I take the Restore. So, so I'd like to say that for the person taking Restore, for the person that took Restore and was stooling a lot, definitely the person's system it was too much for the person's system. So number one thing I would like to say is there's no cause for panic. Uh, is the person should first calm down, and all that that is that needs to be done is a dosage adjustment. Yeah. So if a person took for almost 2 days, I will also still say there needs to be some adjustment that needs to happen in the person's system as well. So I'll tell the person to pause as well. Pause for a few days, say 2, 3 days, and then start with one capsule instead of two. I'm assuming though that the person took 2 capsules. Okay, so usually for me, based on my own experience, I usually tell people to start people off on one capsule for the restore. So after they've used for some time, once they're good, they can up it to 2 capsules, and if that works, they can continue with 2 capsules. So there's no cause for alarm. I mean, there just needs to be some dosage adjustments, and then we're good to go.
Thank you very much. Any contributions to that, Dr. Eric, before we move to the
She
next
has
question?
actually took it
Okay.
from my mouth already.
Okay.
For me, for all my patients at the store, I start them with one capsule per day for 1 week, then bring it up to 2 capsules, after the use of 7 days, so that the system can have some adjustments to it, and so that the person is not tensed and worried that you have given them a laxative to clear their system out. So yeah, dosage is just key.
Okay, thank you very much. And to the participants in the house, I hope we're taking notes and taking note of these. Even though this meeting is being recorded, but I guess it's also good to have some of these answers at our fingertips. Okay, the next question says, what prescription is appropriate for a PCOS patient? PCOS meaning polycystic ovary syndrome. And I believe the prescription they're asking is the reader range prescription. Dr. Rex, maybe you'd
Okay.
like to start with that.
Yes, I can do that. Yes, two very real practical examples, one being my sister and the other being a patient. My younger sister was or has been diagnosed with PCOS, so it messes up her cycle a lot. She can run menses for 40 days, 45 days, 30 days, and all that. And so when Restore came into play, I was really happy because we had to do some adjustments. And then, she was tired of taking everything takeable. So for me, my prescription for PCOS patients that has worked, that I've seen work, is the patient is going to start with the cleanser capsule for 1 month alongside the bitters. And then after completing the cleanser, the person goes for the restore. Restore adjusts the hormonal balance. It brings everything back. It helps to reduce the excess production of these ovaries, the eggs coming up and shooting up. So the cleanser first to do the job of cleaning, to detoxify alongside the bitters. And then after the completion of the 1 month of the cleanser, then we can bring in restore alongside the bitters. The bitters could be either the liquid or the capsule. So my sister doesn't like bitter things. She's a sweet mouth person. So she did restore and the capsule, cleanser and the capsule. While for my other patient did, bitters and the capsule. And after 3 months, my patient came back telling me she was pregnant.
Wow.
In fact, I almost couldn't believe it because the PCOS has been something that has been disturbing her for a while. And then I said, oh, you did the pregnancy test, was positive. Okay, let's do a scan because cysts can be very funny sometimes. Cysts can actually, very big cysts can actually show a false positive pregnancy result. So we did a scan and she was 6 weeks gone already. I said, okay, thank you very much. Your restore has done the job. Please stop now. So my prescription for PCOS is cleanser bitters. After the cleanser, then we'll start restore for 1, 2, 3 months, and then we can keep doing a scan like a month
Every
after you
month.
restore, so that we can be able to find out how well we're improving. Thank you.
Thank you very much, Dr. Rex. Actually, that prescription is well contained in the female wellness pack. We have a female wellness solution pack that
Yeah.
contains bitters, cleanser, and the restore. MI, do you have any contributions before we move to the next
She
question?
has done justice to it. I would have said female wellness part. She broke it down. You nailed it. I think we're just good.
Okay, thank you. Okay, so somebody is saying, this reader, please, where can we get this reader? MI, please, can you tell us where we
You
can get
can
this
get it
reader?
from. Of course, it depends on who is asking. I'm sure someone who is asking, where can I get this reader? Is I'm sure there'll be a distributor around the person. So just grab the distributor closest to you, and you'll be able to get every product in the reader range that you want. And of course, you can come in with any of the packs, and you can get a good discount on the products bundle that you get. So a distributor around you, you're good to go. Of course, if anybody asks me that question, I'll say, what am I doing? I'm
What
here.
about
Let me send you your account number, and then we're good.
Thank you. Okay. Yeah. So someone has a sharp pain at the lower abdomen and unable to urinate properly. He was given antibiotics in the hospital. I would love to know what range of the reader supplements can he use. Dr. Erex, please commence that discussion.
Okay. I'm definitely suspecting that this is a male because I can see that towards the tail end of the question it said, what reader supplement can he use?
Yeah.
So this man is dealing with urine incontinence or okay, either urine incontinence or some kind of
Dysuria.
infection or dysuria, or he's having issues with his prostate. So for this man, the best range of his rider products, will still come from the male wellness pack. We'll have to start with the cleanser first, alongside the rider beaters. And then after completing the cleanser, the reader, then we bring in the reader fire. Reader fire became very interesting to me sometime last month or 2 months ago, after we had that program, Dr. Fumi. So I started using it for my prostate patients, and wow,
Yeah.
wow, 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 wow. The testimony is very alarming. So
Wow.
for this man, let him start with the beaters. He can even, because some of them are more elderly. Some of them are like 60. So if this man is about 60 years and above, or 65 years and above, I would prefer that we taper down the dose of the bitters, so that instead of him doing as much as 20 meals, he can do 10 meals in the morning and then do the cleanser at night, so that he can start having some freedom, and then he won't have reasons to be frequenting the toilet often. So when he completes the cleanser, then he can now commence the reader fire inside the bitters to give him some ease, and then take a lot of water. We can never go wrong with water at all. We cannot
Yeah.
go wrong with water. So taking a lot of water will help him, also. And then he can go back and repeat it. And also, I would also want him to do a scan, so that we know if it is the prostate we're dealing with. He can do a urine culture to find out if it's a urinary tract infection. This test, the reason why we do this test is to let us know how long he's going to be taking which of the products, and how frequent, and what dose he's going to be using. Because I've had to put a patient on double dose cleanser. Instead of one capsule per day, I've had to do 2 capsules per day, because that was what his situation demanded, and it worked. Because when he was taking one capsule, he felt like nothing was going on, and said, okay, jump the dose. And then we increased it to 2 capsules and we got better results. So that'll be my prescription for the urine issues. Thank you.
Thank you very much. Yes, I mean, I think a rule of thumb also is really, while you're managing somebody on a long-term basis, to monitor different parameters, to have investigations at intervals, just to see how it's going, to monitor and see what's happening. Emma, do you have anything to contribute? Would you like to contribute to that?
Well, I'd just like to speak to what Dr. Rex said last. And it's a rule of thumb, yeah. And that's the fact that people need to become more and more comfortable with getting examined. Yeah. Especially as you grow older. You don't want to assume or wink in the dark or play kalu kalu with your health. You want to really be able to know exactly what you're addressing, and that way you can get, you can get help that is focused on what you're trying to manage and solve, and then you can have, a more effective system in place to ensure that you enjoy good health. So, I mean, the older we get, the more we need to warm up with the idea and not, of course, when the average Nigerian, if they are feeling some kind of way, yeah, they just believe that they should take this and that. Just walk into a pharmacy, do this and that, or whatever. I mean, but the truth is, the older you get, the more deliberate one needs to be to get examined, and so that you're choosing the right thing and all. And of course, if it's not, if it's more serious than normal, if it appears to be more serious than normal, then you want to ensure that you get properly examined and you don't take things for granted regards to health. I just wanted to add that
Thank you.
just to corroborate what Eric said earlier. Yeah.
Thank you very much. Okay. Somebody is saying, anytime I take Restore regularly, I do have my menstrual flow twice in a month. What can be the cause, please? Would Emma like to go for that one?
Okay, so let me attempt to respond to this question. I know when you get a question like this, personally, I think this question has a lot of questions inside it.
Exactly.
It will be difficult to just give an answer to this kind of question without asking maybe like 3 or 4 other questions, right? I would like to know the person's age. I would like to know what the person is using it for. I would like to know how the person's menstrual cycle was before the person started using it. And I would like to know how many times this has happened. For example, I mean, because it's a very general sweeping statement. Anytime I take it regularly, how many times has that happened? And then we can, when we have all of that information, we can be able to more accurately give a possible why that is happening. I really want to also know what the person is trying to achieve,
With the
and then
Restore.
of course another thing is, the person's age will also help as well. So there are a number of questions inside this question that make it a bit tough to be able to give one straight
One.
answer to this question. I'm open. I will allow my other organs to please lend a thought to this. That's just what I wanted to
Okay, Dr. Rex, would you like
Emma,
to?
Emma, who are your other organs? Okay, so for this question, I really, really agree with Emma because it's a mother of like 500 questions in one. Especially if the person, in fact, the person may actually be having a correction going on with the menstrual cycle. I may not even know. And I'll tell you why. Because for some people, let me not even say some people, myself, some menstrual cycles are 25 days, 24 days, 26 days, 30 days. So if your menstrual cycle is like mine, that is 24 to 25 days, you're definitely going to see your menses twice a month. Because after the 24th day, we're still in the month that has 30 days.
Yeah.
Another cycle is getting ready. So, or another cycle is popping up already, which nothing is wrong with. So if this person falls into that category, which means that something was actually wrong with her menstrual cycle before, and the reader has done a correction. But of course, so many other things is responsible for the cycle flowing twice a day. So like MI said, if we can trace back, who asked this question so that we can ask all the children questions attached to it, so that we can have a better diagnosis for this person.
Yes. Okay. Thank you very much. So, to all the participants in the house, if you know the person who asked this question, I'm hoping either the person is here or the person, somebody knows the person. Yeah, there are a lot more questions. I mean, in medicine we call it clacking. You take a history and you take a history of the complaint and you take even past medical history will point you in the right direction of being able to make an impression of what and then make a diagnosis and then respond. So thank you very much, both of you. Okay, this is for Dr. Rex. Please, although I know anybody can and any of you can answer that, I'm sure, but please, for the past 5 months now, my manhood has not functioned well. As in, it doesn't get hard at all. What can I use?
Fire, 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 fire. Okay, so I happen to have this exact patient in the clinic on Sunday. He came, in fact, he literally came with his wife because the story was that anytime the doctor examines him, male doctors now, so whenever they examine him, he will have some sort of erection. But whenever he's with his wife, there'll be no erection at all. So I said, okay, fine. Thank God your wife is here. Oh yeah, we locked the door. Let me understand what people are talking about. And so we realized that it's not just that he's not having an erection, it's not staying. So for this patient, we would like to do a seminal fluid analysis. However, it may be a bit difficult because he's not having erection at all. Because
Produce.
and so we cannot get any semen comfort. So we have to build the erection. So for this man, we have to put him on beta and the reader fire for some time. As much as I love the reader fire, I would still love the cleanser to be the first shoot so that we can detoxify. For some people, obesity can be responsible. Diabetes may be responsible. The hypertension may be responsible. So we have to check our grounds, check if this man is diabetic. If he's having poor diabetic control, then definitely it's going to affect his manhood. If he's having poor hypertensive control, it's going to affect his manhood. Or if he's on a long use of some hypertensive drugs that have
Medications, yeah.
side effects of affecting the manhood, then we have to hold the culprit. So we have to check if this man is on any drugs, find out who the culprit is, and then start correcting it with the cleanser, the bitters, and then the fire alongside. And this man would need to stay on fire for some time, 3 months, 4 months, so that we can have good correction. And also, when this man starts having the erection come up, it will be very encourageable for him to do a seminal fluid analysis to make sure he has good sperm counts so that we can know how long we're extending his medication to help the sperm count grow if it is very, very low. Thank you. But of course, my guy is here. So Emma is going to help me out too with more suggestions.
Okay, am I?
There's no help. I've already said everything. You have said it all.
Okay.
Okay. Thank you very much. Yes, I mean, looking for the cause there, you just said it. I mean, what I was going to say, that there are many of those antihypertensive drugs that have the effect of reducing I mean, giving men, yeah, reducing the libido and preventing them from having erections. So that is really important to, I mean, I'm also talking to the participants in the house who may not necessarily be medical personnel, that when somebody comes to you for with such a complaint, let's ask a lot of questions so that even when you're referring to one of the medical personnel, you're able to give a proper history of what's going on. Thank you very much. Okay. A lady using the reader in order to conceive said that she found out that, just a minute, she is lactating after commencing reader supplement and cleanser. Any insight about this? Dr. Erex.
Okay, please. So this
Oh,
said,
sorry, Emma. Well, any of you
okay,
can. So I wanted to say
okay, so let my Oga go. Who am I? Let my Oga finish first.
So
anything.
Dr. Rex, go ahead.
Okay,
Okay,
Go ahead, please. Go
go
ahead,
ahead.
okay. So
Dr.
this lady is trying to conceive, and then she found out that she's lactating after commencing the reader supplement. Which of the supplements? Okay, reader supplement and cleanser. Okay, so if she did bitters and the cleanser and started lactating, something was actually up before that time. It's possible that this woman had a high level of prolactin that is making her to lactate even when she's not pregnant. So we need to do a hormonal profile for her, female hormonal profile, or check her prolactin level to find out what exactly is responsible for her to start lactating. I seriously don't agree that it was a supplement that brought about the lactation, because many women have galactoria, which is bringing out, which is having milk come out of the breast without them knowing at all a whole lot. So it's only sometimes when they come and say, okay, we're trying to conceive, then we'll now start doing examinations and finding out that they are lactating, and they start shouting like, I didn't know this. And we say, yes, you may not know. So let's find out what the root cause of the problem is. Is there something going on in your hormones that is really up? And then we'll check it out and then start correcting. And then once, I think once that is found out, we can put her on restore, to help with the correction of which of the hormones that is, misbehaving. But most likely the prolactin is what is responsible for this.
Thank you. Emma, would you like to say anything?
Dr. Rex took the exact words out of my mouth. You know, of course, when you hear lactating, you know it's high prolactin. Of
Prolactin,
course,
yes.
for a person to be averagely trying to conceive, averagely, I mean, I'm choosing my words carefully, averagely trying to conceive, it means that the hormonal levels are not optimal. They are not as they
True.
should be on the average. Yeah. So it's now when, like Dr. Rex said, you need to do a hormonal profiling to know which is off, what you need to do, and all of that. So, of course, I've had cases of I know a particular lady who she's very single. I think she's 23, and by the time I met her, she had been battling galactoria for like maybe about 2 years. She said she had
Wow.
used all sorts. She was using a particular medication that, in her own words, I don't want to mention medication here. In her own words, the side effects were driving her nuts. Yeah, and she said she just wasn't ready to go that route again. So definitely there needs to she needs to know that it didn't happen because she started using the reader product. The fact that she was trying to conceive almost indicates that, hormonally speaking, there has been an imbalance, and
Truly.
she just needs to keep at it for a period of time, um, and she will see the effects over time. Of course, if she's trying to handle this and then trying to conceive, then she needs to make a 3 to 6 month plan, yeah, of using this, and we see how that goes. So there's no cause for alarm, just to show that sometimes you use reader products and it really does bring out, what was there, and that's what oxidative stress or antioxidants actually should do. So that's what I would say. Yeah, just what Dr. Harris has said, just in another way, really. Thank you.
Okay, thank you very much. Now, before we go on, I'd like to ask our participants in the house, are we getting value from this? We're a bit quiet. I just want to be sure that the conversation is not just between myself, Dr. Erex, and MI. If you're getting value from this, please can you type yes in the chat box so that we know that you are hearing us. Okay. Yes, yes, yes. Thank you. Yeah, yes, so yes, 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 yes. Great, great. Okay, so we move to the next question, which any of us can answer that. It says, what is inside this reader bitters that gives you crazy energy when you take it first thing in the morning? Crazy energy. So anyone can go for that. But we can
Emma
all
is the farm.
contribute.
Emma is the farm. They are the ones that know what is inside the jug. She will tell us. Hello.
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 Okay, can you hear me?
Yes.
Yes, very well.
When, of course, I've had people with different health issues ask what is inside this reader based on their different experiences. I would let me mute. Let me mute. Okay, cool. So when someone says you give them crazy energy in the morning, I just smile. Do you know that sometimes people say that when they take it in the morning, they just want to go and sleep? You know?
Wow.
So that when they take it in the morning, I've heard that a few times. And the only answer that I can give to that is still the concept of oxidative stress. Yeah. I would like to say that it's and I think, of course, in time, science has come to see what antioxidants can do, what oxidative stress is, and how it directly impacts different organs and different parts of the body. So you can't speak it away, as it were. Okay, so is what it means when it gets into your body that it will work on. Yeah, but of course, when a person feels well, when toxins are out of the system, when free radicals that have the capacity to come together and make you feel unwell are taken out of your system, then you will feel well. You'll feel energized. You'll feel better. You'll feel light. I hear that too. People say, "Oh, I feel light. I feel," many times some things that happen to people, just fatigue, tiredness, headache, is oxidative stress. So when you have something that mops that up within the body, you feel like alive. You feel, you know, you just feel good, like you feel healthy. Some people say they go to the restroom, and then when they finish using the restroom, they just feel good. They feel like some dirty things have left their system. You hear different kinds of things, but the answer that for me, I would like to give is the antioxidant properties that are in the reader bitters. That's what I would like to say.
Okay, thank you very much. Yes, I mean, when I read this question, I smiled because this is how I feel too. I know that I take reader bitters regularly. Occasionally I pause, but the days I'm going to pause are going to be days that I don't necessarily need to have too much energy, because I know that the days that I take it, that energy is there. And like Emma said, the individual, the key ingredients, they all have strong antioxidant properties. And so just like you said, Emma, that is it really. Dr. Rex, I wonder whether you'd like to contribute to this.
Okay, let me just say one or two things that would also help our participants. If you look at the reader bitters, it's something I've even had to just put up on my head a lot of times so that it's just easy for me to say. You look at one on the pack, you see supplementary facts, vitamin A, C, D, E,
Yeah.
thiamine, riboflavin, vitamin B, C, and all. These are natural vitamins that when you take them normally, your ginger will be up. You will be hyper in the day. I would even like to use myself as an example. In the past 24 hours, I've been feeling very bloated, not fine, uncomfortable, and all. So this evening, I just told myself, I think I even need to take my bitter so that, and immediately I did. About 6 minutes after or so, I just went decongested and I felt lighter. And that's exactly what an antioxidant will do for you, like MI said. Once you get rid of the negative stuff in the body, your body feels lighter. It's like you're pressed to urinate or pressed to poo poo. The moment you ease yourself, the moment you go to the toilet and remove the wee wee or the poo poo, you feel lighter, you feel free, you sweat off. That's exactly what it does. So that is the thing that gingers the swag inside your body.
Thank you very much. Um, Please, what can a person with kidney stone and appendicitis use? Dr. Erex, maybe you can start off that.
Okay, I think cleanser and the bitters, cleanser and the bitters, cleanser and the bitters is just the key for it. So if it is appendicitis, if it is kidney stone, if it is even gallbladder stone, because I had to use one with my urologist recently. So he was just, going around and the patient didn't want surgery and all of that. And so I just told myself, okay, Chief, let's give this a shot alongside every other thing this one is taking. And before you know it, in fact, the size of the stone became so small, so small. So and he just told the woman, just go and meet Dr. Rex. Anything she just asked you to drink, just be drinking. It's working for her. So it's just the cleanser and the bitters are our key for this.
Thank you. Emma, would you like to say anything more?
Well, yes, of course, the bitters and the cleanser, most definitely. Assume that for this diagnosis to exist, the person has been examined and there has been some scans and stuff. So it's important to be examined, and then in the course of using this, after a while, it's good to also check to see what progress is being made as you use them, so that you can measure and see how it goes. Of course, we've had tons of testimonies with people use. In fact, there was one I heard. I've found it a bit tough to kind of share it. There was actually a rupture, was appendicitis, and you know, she was given a date to come clean off or something, given some antibiotics, and they said, okay, if it doesn't, if things don't progress well, they may need to do this, and that. Okay, and then she was placed on the bitter cleanser and went for a scan. I can't remember how long after, and she was good and done. So I would. It's good to get examined, and of course, bitters and cleanser, and get examined again as you go, just to see the progress you're making.
Thank you. I would just like to add, for the participants in the house who are not medical personnel, if a person has appendicitis and it's acute appendicitis, it's usually a surgical emergency, and it will be good to actually go to the hospital so that if a decision is to be made not to operate, it will be made by a qualified person. So not to stay at home with acute appendicitis. But obviously, for it to have been diagnosed, the person, like MI said, must have seen a doctor. So the last question here, and I don't see any questions in the chat box. So the last question here uh, goes to MI. A lady's breast milk is still flowing after she has stopped breastfeeding since the past 1.5 years. What can she use?
Hello.
Hello?
Okay, I think we already kind of spoke to a related question earlier. Okay,
Yeah.
for a child to be a year and a half, I assume that the child has been weaned already, so the person
Mm,
already stopped. Okay, yeah, it says stop breastfeeding since the past 1.5 years. Oh wow. Okay, so that's a clear case of of a hormonal imbalance, right? So that straight away go to the female wellness pack, and you're good to go. So I mean, is increasingly that many women have hormonal imbalances. I mean, and it's not, for some people it's not a constant state. Stress can trigger it. Uh, Different things can trigger it. You know, your state
Mm-hmm.
of mind, your different things can really trigger it. And for some people, I they've had it over a long period of time, so it becomes like chronic-ish. So it can lead to maybe infertility and stuff like that, you know, on the average. So that's why I personally recommend, I mean, for women who are 40 years plus, if you are like, if you are moving to 45, yeah, I would advise personally that you make a habit of taking the Reader Restore once a quarter, or at least once in 6 months. Yeah, so it's good, because the average woman actually would oscillate, and you really don't know exactly where you are per time. So it's good, like Dr. Rex also mentioned earlier, it helps to balance the hormonal um, system. And a woman is really all about hormones. Our hormones make us, they affect everything about us, affect our, and it's not only the moods and the feelings and all that, it's our skin, our hair, our glow, everything. So it's not, sometimes it's just, oh, I don't want to give birth again. I don't want to do this. It's much more than that. Our hormones affect everything. So, I mean, if you want to like maintain by 45, your body is trying to enter second half, so it needs some support, some assistance, you know, that kind of thing. So sorry, I just delved into, use this opportunity to say, I mean, hormonal imbalance is not, it's not out of this world. You know, it can be helped. You can proactively ensure that you don't have a chronic situation like that. But for this person, the female wellness pack, I think just works well for her.
Wow, thank you very much. Dr. Rex, anything you'd like to add?
Emma hits it from all the angles that I was really just thinking about in my head.
Okay.
For me now, I've even helped Emma to calm down. Once you're 37 and above, just start getting ready with Restore, because we are realizing in the gynecology region that menopause is becoming faster. It's starting up way earlier these days. You see people at 37, 38 are already looking at menopause. We see people at 40. In fact, my own mom started at 40. And that was one of the biggest struggles of her life. And she was like, no way. And I said, man, welcome to menopause. So that told me something, that is very likely that I'm also going to take the same pattern. So I have to start getting myself prepared. So for women who have passed or who are done with their family cycle, what I mean by family cycle is they have completed the number of children they feel they want to have. Please, it's just early. It's just good to start the store on time, because there'll be so many hormonal changes, stress, like MI said, anxiety, worry, poor sleep. A lot of women in Nigeria, particularly, do not sleep on time. You have a lot of things still doing at home. We have work and all. So it would just be good to have these hormones, start learning how to get balanced on time. And like MI said, once in 3 months, once in 6 months is just the perfect shoot for it.
Okay. Thank you very much. Now, I'd like to ask, do we have any guests in the house? I know I should have asked this earlier, but do we have any guests in the house? If you're a
Yeah,
guest, we'd
everyone is
love to.
there.
Okay, please, can you tell us, signify and tell us who invited you so that we can welcome you warmly? We are glad to have you here, okay? Ifeoluwa, okay, no, okay, you are answering to something else. Please, if we have any guests in the house, let us know so that we can formally welcome you. Well, we're gradually coming to the end of this session. I know that it's been very insightful, and I want to believe that everybody in the house who has been listening has learned quite a bit. And in case we have any guests in the house, these products are,